Hi there, my name is Caitlin, and I'm giving my informative speech paper on HIV and AIDS. So I'm starting off with a visual, and this is a map of the world. And all the different colors represent a different percentage of adults who are living with HIV. And as you can see here, in southern Africa, the red here, this represents 15% of adults are living with HIV. And up here in Russia, that's 1 to 2% are living with HIV, the yellow there. And so I just want you guys to see that HIV is a big deal in the world. So here we go. So the first question is, what is HIV? HIV is human immunodeficiency virus. So human meaning only humans can contract it. Immunodeficiency meaning it attacks your immune system and it tries to weaken your immune system. A virus means that it reproduces again and again, trying to take over your body. So what does HIV do? HIV, it starts destroying your CD4 cells, which is in your immune system. And once those are pretty much broken down, that will lead to AIDS at that stage. And the HIV has two different stages that it can have. You can be asymptomatic, which means you show absolutely no signs of having the HIV. So it can just lay dormant in your body for up to 10 years. And then after that 10 years is up, you will go to full-blown AIDS. And the other stage is symptomatic. And if you're symptomatic, you show signs that you have HIV, but you may not know that you have HIV because you could just be getting sick with things as a common cold over and over again, and you just think that you have a poor immune system or something. So pretty much once you have full-blown AIDS, you're stuck on full-blown AIDS. You don't go back to HIV ever. You have AIDS now. And so the question is, what is AIDS? Okay, so AIDS is acquired immunodeficiency syndrome. Acquired means that you contract it. You don't get it from your parents. You have to contract it. Immuno meaning it attacks your immune system. Deficiency meaning it makes your immune system not act right. It's deficient. It doesn't work right. And syndrome meaning it's like a collection of the symptoms and signs of the disease. So what does HIV leads to AIDS. What does AIDS do? AIDS, it breaks down your immune system so you have no immune system. You have nothing to fight off the common cold or the flu or anything that your body can normally just fight off. So eventually, a common cold can kill you, or the chickenpox can kill you. It's not the AIDS that kill you. That just breaks down your immune system. It's the common cold or whatever else that kills you. It's that bug that kills you. So pretty much, now that you know that what HIV and AIDS is, the question is, how do you get it? Okay, there's 3 major ways that you get it. From blood-to-blood contact, so like sharing needles, like stab yourself, you have HIV, then you go stab someone else, which you shouldn't be doing, but if you did go stab someone else with that bloody needle and you have HIV, you can give it to them. Another way is birth, so through like the birthing process of the mother, like pushing out the baby, there could be some ripping and tearing in the mom, blood-to-blood contact with the baby there, so same type of thing, just different circumstance. Or through breastfeeding, so the mom can give the baby HIV through her breast milk. And the last way is through sex, because there is concentrations of HIV in semen, vaginal fluid, and blood, and all those do happen during sex. So prevention would be, you could have, if you're practicing sex, you could practice safe sex. So using condoms, don't be doing anal sex because things are supposed to come out, not go in, and there's a whole bunch of extra ripping and tearing in that, so major risk for blood-to-blood contact there. The mother-baby thing, that's pretty much a given. It could happen when it's birthing, but prevention from the breast milk is you can switch to formula and just use formula instead of breast milk, so you don't have that risk there. And blood-to-blood contact is pretty much don't share needles. You don't, get a tattoo with one needle and put the needle in someone else. You just don't do that. That's gross. So pretty much that is prevention. And once you have it, and you know you have it and everything, you're going to want to know the treatment. So the treatment is you have to take a whole bunch of pills, and all this like collection of pills is called a cocktail because it's a whole bunch of things mixed together, and you have to take this a lot. Sometimes you have to take it at 3 a.m. with a meal, so you have to get up early in the morning and eat. Other times you have to you're not allowed to eat with some of them. Just pretty much it's very difficult to stay on top of this, and it is expensive. So it's expensive, it's hard to deal with, and the main thing is those are treatments. There's not a cure. There's no cure for AIDS. So pretty much be careful. AIDS is out there, it's a risk, and yeah, hope you enjoyed my movie.